This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live, right now, on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Live in studio, absolutely waiting for your phone calls. 888-630-9625. That's 888-630-9625. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem. You know, you've searched, you've applied, you've tried, you've done all those things and come up with the same old, same old. Nothing that really works, maybe just makes it worse, right? You live with it and limped with it for many years. Well, here's an opportunity. Let's try to figure out what we can do to turn the fire off, so to speak, and get you back into functioning order so you can live your life the way, you know, the good Lord and nature made it possible for you to do so. However, it's stolen from us on a day-to-day basis. You are programmed on a day-to-day basis to take X, Y, and Z medication and drugs and all kinds of things. And if you don't believe that, understand that Fifth Avenue marketing, along with Big Pharma, the drug companies, spend approximately $10 billion, that's with a B, billion dollars a year to program you to take their medications. Now, they spend another $20 billion programming your medical physicians to give you what they think you should need. But that's a horse of a different story. Today we're just going to tell you the truth on a couple of things. But remember, it's $10 billion. The commercials that you watch on an ongoing basis, you know, they're beautiful. They have songs. And then the subscripts, you know, they said it very, very fast, like a didactic kinetic compression of words, and, you know, including death. You've all seen the commercials. Well, here's the deal. And I want to talk to you about something that's generally not a prescription item, but there's probably 20% of our population that takes it on a regular basis. It results for a minimum of 15,000 deaths a year. The effects for the elderly of our population are even much more devastating. It causes approximately 25% or 27,000 men to lose their hearing. It produces about 40 to 60% of cardiovascular problems. 7,000 people are hospitalized with gastrointestinal problems, and 60% of the people that are taking this end up with something called heart failure. I mean, it's like it quits, it doesn't work anymore, and up to 30% have a dramatic increased risk of allergic response to all types of things. And ladies, unfortunately, if you're pregnant and you take this stuff, you're going to increase your risk of miscarriage up to 80%. It's incredible, and we put it out there without a prescription, without really any education about what it's all about. But your pain and your headaches and your back and all those things, and you reach in the cabinet and you take, what am I talking about? We're talking about a group of drugs called NSAIDs, non-steroidal anti-inflammatory drugs. And we're going to talk about how they work and how they affect you. But the thing of it is you have to understand that aspirin and Motrin and Aleve and all of these things are grouped into this category of NSAIDs, and the side effects are significant. And we worry about the measles out there. You know, how many cases do we have? Or the Ebola, potential. How many people actually died? We're talking about 15,000 people who die every year from the use of NSAIDs. 15,000. This is not okay. And, you know, we're looking at somewhere between 60 to 70 million people who do this. You know, they don't think about it. Oh, give me an aspirin. Or your doctor says, take these aspirin, you know, to prevent heart problems. Well, you know what? Here's the deal. When you do that, when you take those medications, you actually increase your risk of all of those things. So let's talk about how NSAIDs work first. Well, NSAIDs are these substances that decrease inflammation and supposedly control pain. They're non-steroidal anti-inflammatory, so that means that they block the inflammatory producers. And there's something called a COX-2 inhibitor that is the most dangerous, and that's where they go after. And then the side effects start kicking in. So what are NSAIDs, right? So NSAIDs, prostaglandins, are a family of chemicals. Okay, they're produced by each cell, and they have really important functions. Now, what we're talking about are these COX-1 and COX-2 inhibitors. Don't worry about what they are. Just understand that they're called COX-1, COX-2. I'll probably try to give you a little bit of background on it. But prostaglandins are produced by the body cells. Every one of your cells in your body produces these COX-1, COX-2 inhibitors. And they're there for a reason. They just didn't show up. The problem is when they get out of control. Both COX-1 and COX-2 produce these substances that we just talked about called prostaglandins, and they promote inflammation, and they promote pain, and they promote fever. Interesting, right? So why would we want those things? Well, only COX-1 produces these substances, these prostaglandins that support platelets. And that means, the stuff that stops you from bleeding and increases healing process and so forth. So COX-1, we could say the white hat and the black hats. The white hat guys, these COX-1s, aren't bad. They can get out of control as well. But nevertheless, they help in protect one area of the body that's called the stomach and the digestive functions. Non-steroidal anti-inflammatory drugs blocks COX enzymes and reduce this cascade, if you will, of prostaglandins, throughout the entire body. As a consequence, ongoing inflammation and pain and fever are reduced. That's why you take them. If you're hurt, go take 2 aspirin, call me in the morning syndrome. If you have a fever, take a couple aspirin. It'll help bring the fever down. But all of these things are deleterious and dangerous and a detriment to the body's normal function and how things work. So since clotting is reduced by this situation, NSAIDs, one of the particular things it can do is increase the risk of stomach ulcers. Now your stomach is raw. So when your doctor says take an 81 milligram aspirin every day, one of the things that you're doing is you're dramatically increasing your risk of many things. Heart failure, by the one is one, and we're going to get back into that. We mentioned it earlier. Erosion of the stomach. You have a lining on your stomach that protects you. And the NSAID, the aspirin, the non-steroidal anti-inflammatory, decreases the lining, so now you become more susceptible to all kinds of invaders. Not only the irritation, the ulcer that you're getting, but the invaders from the outside, the microorganisms, the bacteria, the viruses. All these free-floating allergens that are out there right now, the mold and the fungus and so forth. If you're taking NSAIDs, your problem is going to be exacerbated. You're going to be worse off because of it, because you're causing your stomach protective barrier, your ability to fight these things, to go away. And subsequently, you're going to have more problems. Now, if you add that to things that suppress stomach acid, now you really got a trouble. So what are we talking about? We're talking about a group of medications, aspirin, Celebrex, by the way, which was taken off a few years ago because the interesting side effect was potentiated. It's called death. No warnings whatsoever. You would just die. And so that was 500 milligrams. Now they've put it back on the market around 200. But just make sure that if you're taking it with other non-steroidal anti-inflammatories, you're adding aspirin to it or Advil to it. There's things called diflusol. That's a brand that was recently discontinued because it caused increased risk of the things we're talking about. There's one that's called Lodine, and that's been discontinued. So they know that there's ones that make it even worse. But how about just simple ibuprofen, Motrin and Advil? How about indomethacin, just Indocin, right? Those are all NSAIDs. So how many of these are you taking? How many of these do you have in your cabinet? Naproxen, same thing. Aleve, Anaprox, Naprolin, Naproxen. All of these guys are common, and we use them all the time, and the list goes on and on and on and on. So you have to make sure that you understand that there's a game of Russian roulette that you're playing for that pain that you have. And the common side effects, just the little guys, right? You're talking about nausea. You're talking about vomiting. You're talking about diarrhea, bloody diarrhea sometimes, and bloody vomiting. Constipation just ties up your system. It reduces your appetite. You don't feel like eating. If you're really sensitive, you can get rashes, and you're going to get dizziness, and you're going to get headaches, and you're not going to be able to focus. All of these guys are, if you look up the side effects, they are common I mean, they do show up on a very regular basis, side effects. So do your homework on this. We're going to talk about it a little bit more. It's important that you understand this, particularly when there are other ways of controlling pain and inflammation. You're putting up with pain. You're putting up with your neck pain and your shoulder pain and your back pain because you're taking a non-steroidal anti-inflammatory, that headache that comes. Well, headaches, and you have to understand this, are not aspirin deficiencies. But you eat the aspirin like it's candy, and you're trying to quell the thing. The better question becomes, why is it there in the first place? What brought it about to cause the problem to show up, and why are you putting up with it and just masking it and covering the situation? Pain is one of the things in our practice that we see every day. We see a pain of reflexive nature, meaning it comes from the internal system of the body, the organ systems. They reflex into the structural system of the body. You're eating things that are inflammatory in nature, spiking the COX-2 patterns and causing your body to be much worse than what it needs to be. So your joint spaces begin to hurt. And then what happens over time, because you've been putting up with them for such a long period of time, you start degenerating, you start breaking down, and pretty soon you go to the doctor and he says, well, you have arthritis, joint space, itis, inflammation. Does it sound familiar? Arthritis. So what are we doing about that? We're taking more steroids and we're taking more NSAIDs, causing the problem to go into further exacerbation over a period of time. Pretty soon you lose height because your joint spaces begin to narrow. Pretty soon you lose function. You can't move a joint space anymore to do anything. You can't lift your children or your grandchildren. You can't do the things that you want to do. Golf is out. Tennis, forget it. All these things begin to compound one onto the other. Do you see what's happening because you're being sold a bill of goods? Do you understand the process? Do you understand that you're being duped on a constant basis when there are other things that can make a difference, let alone there's things that you can do to prevent the onslaught, the process of that breakdown? We got a couple minutes, and I want to talk to you about something that you can learn intimately. We're going to continue on the subject of these anti-inflammatories and how they work. I think you're going to be amazed that your finger's been in the pot because your finger's been told what to do and how to stir it, and you're causing your body some degradation. This afternoon, as soon as the program's over, I'm going to the Angelica Film Center in Maryfield, Virginia. And it's a place called the Mosaic. It's one of these like little developments, but it's the Angelica Film Center. It's literally half a mile off the National Capital Beltway. And what am I going to do there? Well, the Angelica Film Center today is going to be showing the PBS documentary that was done on our work, and they held it for 2 years. It could only be shown on PBS channels. Some of you have seen it, some of you haven't. But this will be the last opportunity for you to see it in this area. This year, it's not going to happen again, and it's being sponsored by Caring for Others. Caring for Others is a 501c3 foundation, and that we work intimately with, and it's a fundraiser for them. It's $10. It's nothing. It's a 501c3 that you get to deduct off your taxes straight up. You're going to get a receipt for being there with us. The program, I'm going to be there, and I'm going to introduce the program to you. I'm going to tell you the background, what happened. It features 6 patients who had failed under traditional care. A woman with MS, another woman with such severe anaphylaxis and seizure problems due to everything in her environment, a little boy who was so ADD, ADHD, he was off the charts, a tennis player, a fireman who had back pain, had been to everyone, including chiropractors and osteopaths and medical physicians, orthopedic surgeons, and nobody could do anything for him. An older man who had TIAs, strokes, migraine headaches, and you know what the commonality was? 2 things. They were treated medically and failed, and they were treated through conservative care of acupuncture, nutrition, chiropractic care, manual manipulation, and every one of them turned around 100%. I'll talk to you a little bit more about that. We're coming up to a break. There's several of you on the line right now. We're at 888-630-9625. That's 888-630-9625. We're going to take all your questions. We're going to talk a little bit more about these crazy NSAIDs that kills 15,000 of you every year. Not one of those things that go into my body, because I know how to handle the pain and inflammation without resorting to those drugs. Stay tuned. This is Dr. Tom Roselle.
Did you know that routine mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? Now consider a simple, non-invasive, and totally safe medical procedure approved by the FDA since 1982 that can detect breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect the initial signs of breast cancer as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call the Thermography Center of Fairfax to schedule a breast exam today at 703-948-7248. That's 703-943-7248. For more information, visit www.thermographyscan.net. That's thermographyscan.net for the Thermography Center of Fairfax.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and a thermographic breast scan as part of your annual wellness checkup.
Welcome back, everybody. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio. 888-630-9625. 888-630-9625. That's how you find us here. And if you have a question and you don't want to come on the air, what you can do is you can go to RoselleCare, RoselleCare.com, and check it out. Also, I want you to go to drtomroselle.com, drtomroselle.com, and you're going to find all kinds of things. Actually, I think it's Dr. Tom Roselle Live, but you can check out either way. A new website that is being enhanced on an old website, and there's going to be a lot of things that you need to know, things that are coming up that you really need to be involved in. We do this program every Sunday, and we'll continue to do it forever, as long as I'm on this planet, to bring you the latest and the best cutting-edge information on integrative and natural therapeutics so you can help yourself get well, because your health is a do-it-yourself program. And by the way, the name of my book that was out a couple years ago, if you don't have a copy of it, shame on you. Go to our website, go to RoselleCare.com. You can order it, or you can go to Amazon and pick it up there. Health is a do-it-yourself program. It was written specifically for you, so it gives you a path, a plan of how to put your life together. But more importantly, it allows you to understand really what happens and how it breaks down. Jim, thank you for calling. How can I help you, sir?
Hello, doctor. I have a approximately 22-year-old nephew down in Florida, recently moved down there, and and he's been diagnosed with Tourette's syndrome, and he's had it ever since he's, I'm going to say, about 10 or so, and I have never lived close to him, so I'm not familiar with all the care he may have had, but I understand from his mother that he did receive some medications, some time ago, and I would assume years ago, and it didn't work, and he doesn't want to do it again. But with little I've read about the subject, it sure explains a lot about his behavior, which, at first blush it seems to be antisocial, but it really isn't. A lot of defense mechanism activity that you really need to understand.
Yeah, and it could be across the board. It can be very mild with Tourette's. Obviously, it's a compulsive, as the literature would tell you, it's a compulsive disorder. It can be just body movements and tics. It can be very unsocial, words and so forth that are something that none of us would ever do on purpose. But it's an obsessive-compulsive disorder in many situations. It can be a sleep disorder. It can be a detachment disorder. Can be an attention deficit situation. We have to be very careful how you describe these things, because there's so many overlapping symptoms to other conditions, particularly with ADHD. A lot of psychologists want to say, well, it has to be Tourette's because they can't figure it out any way. Tourette's is, in most situations, it's a genetic pass-through. 50% of us who have, it's a 50% chance of passing through the gene of someone who has Tourette's. So this young man, if he marries and if he has children, he can pass that through. Girls with the gene have a 70% chance, if I remember correctly, of passing it through, and guys much, much higher. Boys have a greater tendency to portray the symptom process much more so than girls. Again, it can be a multidimensional complexity of symptoms, and it seems to link to the family. But here's the other thing that we've seen, and I'll give you another look at it. It can be also related to trauma and intestinal tract dysfunction. Let's take the intestinal tract first. Why? Well, there's a lot of research that says that Tourette's shows up because of an imbalance of serotonin and dopamine in the body. And 80% of the serotonin and dopamine is produced in the intestinal tract. These guys are neurotransmitters, and they seem to be very much involved with a Tourette syndrome across the board. So you look at pass-throughs, you look at sensitivities, you look at toxins, allergy reactions, heavy metals that get locked into the nervous system. We've treated many children and many adults with Tourette's, and across the board we see that. The other piece that we see is trauma to the cranium, to the skull. Child who is born with forceps, a child who's born who is breech, and they put enough pressure on the cranial plates that they get stuck. So now you have an electromagnetic imbalance. The commonality is that the serotonin and dopamine patterns are upset, but again, notwithstanding the fact that it also is a genetic linkage as well. So as you've heard me say many times, just because you have a problem doesn't mean that you're going to portray the problem. There's ways of handling that. Jim, what I'd love to do for you is that send me a note at rosellecare.com, and I will give you a referral in Florida for someone who I would trust to get the job done. It's one of those things that can be managed. It's one of those things that can be dealt with without medications, without drugs. I feel your pain. I wouldn't be going that route. Acupuncture has been known to help as well, but you got to clean the gut up. You've got to make sure that the nervous system, the neurology is working the way it's supposed to, and things can happen in a very positive manner. I've seen it repetitively over the years in 39 years of clinical practice. So send me a note. Let me see who I can find for you. Happy to do it. We've got to take a break. You're listening to Dr. Tom Roselle Live.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
Dr. Tom Roselle Live continues now on 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live in studio, 888-630-9625. That's 888-630-9625. Love to talk to you on any subject. Doesn't make any difference what it is, whether you're on topic or off topic. Let's handle it. See what we can do and make a difference in your life. I'm here for you. That's the only reason that we do Dr. Tom Roselle Live, and we've been doing it for many years, as you know. And we try to reach you with all of our in-house continuing education programs on many different subjects. We do them every other week. If you'd like to find out about them, go to our website, go to rosellecare.com. Remember, all of our in-house programs, the ones we do at our center, are a gift to you. There's no charge. There's nothing required of you, with the exception of a reservation. So go to our website, go to rosellecare.com, check it out, see what the subjects are. You can show up for one, you can show up for all of them. We'd love to have you. Come and see what our doctors have to say and take control, take charge of your life, your health, and go buy a copy of my book, okay? Remember, Ageless Health, Health is a Do-It-Yourself program. You got to have that book. It's like, really, you don't have one yet? It's already sold over 10,000 copies. I mean, how come you're not one of them? We're talking about a subject that can kill you. 15,000 people a year die from this particular medication, and it is a non-prescription medication. And we're talking about NSAIDs, non-steroidal anti-inflammatory drugs that, come in the name of Advil and Motrin and Aspirin and so forth. Years ago, there was a category that was called Vioxx and Celebrex and Bextra. You know what they did? You know what they had in common? They took it off the market. Why? Because it was going to kill you. And many of the countries stayed away from it. There was another one interesting that was taken off about 8 years ago, I think it was, something in that neighborhood, and it's called, I can't remember how to pronounce this thing, and I'm going to mess it up, so I'm going to spell it to you. It's Prexige, and it caused all kinds of problems with hepatic failure, liver failure. It caused people to have liver transplants. There were some deaths that were associated with it. So these things, we're out there, and we're talking about the hysteria of things that the government wants you to be afraid of. And yet, because of the combination, we used to, in the years of Vietnam, we talked about the government and corporations having this intertwining situation, and that's why we fought Vietnam and the like. Now we've got the drug companies and the government, in my opinion, working hand in hand. And, I'd love to have debates with people. It's fun because I've got the data in front of me, and we can sit there and say, okay, well, you want to explain this, we'll go from there. But remember that aspirin and naproxen. Naproxen was an interesting drug, came out in, I think, 1973, going back to the 70s again, and it was used very, very significantly between 2005 and 2006 by almost 500,000 people. This particular drug was associated with blood clots, and you'd end up with a stroke, you'd end up with a heart attack. Straight up aspirin dramatically increases the risk of heart attacks and strokes in men 45 to 79 years of age. The interesting thing here is when we have these statistics, why does medicine not tell you about them? Very simple, because most of you people who are in trouble are in your later years, and they say it's natural causes. You die of a stroke, you die of a heart attack, you die in your sleep, and they must have thrown a clot. It's common. It's natural causes. Not so much, my friends. You're meant to be on this planet a long time. The problem is that we're slowly killing ourselves. Marcy, thank you for holding. How can I help you?
Hey there, Dr. Roselle. Nice to talk to you.
Thank you for calling.
I have a problem with cholesterol. It's at 240. I thought that was good. My doctor takes my blood quite often and wants me to go on statins.
Statins, of course.
But now he says there's a new Lipitor or something he wants me to take.
Yeah, well.
Well, this last time I went to him, because I was having heart palpitations over some stress, and so I went to him. But this time my cholesterol was 308.
Yeah, that's pushing. So let me tell you what's driving your cholesterol. It's a couple things. It's a fight-flight system called your adrenal glands. And you're getting your system cranked up so high, and that works with every pathway in your body, including what we're starting to talk about today, inflammatory reactions within the system. So when you have inflammation that goes up, your body by defense is going to have a certain amount of fat in there to dampen it. You've got to go into a neutral state, a pH of at least 7. If you stay a pH of less than 7 in your bloodstream, by the way, is what I'm talking about, you're going to die. And so your body does it by an automatic protective pattern, and you're also going to put calcium in there, so you're going to end up with some hardening. So let me ask you a couple quick questions, Marcy. How old are you?
62.
Okay, great. So, you and I are in the same neighborhood. I'm older than you, but the bottom line is that if you make some changes, when you're under stress, if you want nutrients, you take a good natural B complex, you take things like coenzyme Q10, you take magnesium, you make sure that your diet is clean, that you're getting tons of vegetables, and your proteins are good free-range proteins and eggs and chicken. And, people say, oh, my God, I can't eat eggs because they produce cholesterol. Well, your liver is what produces cholesterol. You need the omega fatty acids on free-range organic eggs actually to balance all that out. It actually is a different thing. You want to get your body as alkaline as you can. You want to walk every day. You want to find a way to blunt the stress, be able to change your outlook either through prayer or through meditation or a combination, and do things that are gently calming to you. That will come down. Another thing that will drive fats in your body, particularly triglycerides and LDLs, is sugar. If you have a sweet tooth and you're grabbing something all the time, or a couple times a day, and you're under stress, your cholesterol is going to go through the ceiling. There's other things that you can do. I don't know you. You're not my patient, so I can't prescribe for you. But there are things like niacin, and there's things like magnesium, and there's things like even garlic, and there's I can list about 20 different things that will help bring your cholesterol cholesterol, but it starts with controlling the things that you and I have just been talking about, and it can make a huge, huge difference. Sue in our office, my wife, obviously, I deal with my nutritionist all the time. She's excellent at going through this, and the docs in our office, we see these kind of things all the time and how they affect the nervous system. So love to help you. All you need to do is give us a call. If you can give me some private notes, I can be much more specific with you. But you don't have to deal with this. This can be turned around, and you don't have to do it with medication.
Good.
Marcy, appreciate your phone call. Thank you so very much for calling. My dear friend Bernice, how you doing, hon?
Good afternoon or morning. It's morning here.
I know. How's Arizona doing today? Beautiful?
It's nice and warm. Nice and warm. It's beautiful today. It's not super hot, so it's beautiful. I have a question. You were talking about the NSAIDs. Well, I have a cousin that has pain all over her body, and they've never been able to find out what it is, regular doctors. And so they told her a couple of months ago she had cirrhosis of the liver. And she never drank, she never smoked, so I suspect it's from all the medications and the aspirins or Tylenol, whatever she takes,
If she's taking Tylenol, Bernice, we were talking about it off air here just before we came back on. The number one cause of liver failure that requires hospital emergency admission is Tylenol. Okay, so anybody that's taking Tylenol on a regular basis is risking liver function. And unfortunately, way too many people end up in the hospital. The statistics are there. Where's the pain with this person?
It's all over. They told her she had fibromyalgia and...
Bernice, she's got to go see somebody who does the work that I do. There's no reason for her to be taking all this junk.
But where in New Mexico, in Santa Fe, near Santa Fe, can she find a doctor?
Easy. Again, do me a favor. Send me a note, okay? And go to rosellecare.com, and I will send you the names of people who are members of our organization, the International College of Applied Kinesiology, and I will find someone who does the work and does it right, and I'll make that recommendation. There are people there, and there's really some very, very good people there.
Okay, and my other question was about low-dose aspirin. Is that dangerous? Because a friend of mine, she's about 80-something.
Absolutely dangerous. 81 milligram aspirin, the baby aspirin that all these medical physicians want people to take. Last summer, in August, I think it's July or August, the FDA had to do 180 degree on their recommendation for aspirin. And what they did, they actually came out and said that all the things that we've been saying for years, that causes kidney problems and heart failure and bleeding, and it increases the risk of certain types of cancers, decreases immunological response, and so forth. And they really had mud on their face. So you have to take a look at what it's doing. All you got to do, if you want to look it up, side effects of aspirin. And you can find all kinds of things. I would never take aspirin on a regular basis for any reason whatsoever. There's too many other things out there that work better and are natural and don't hurt. Listen, let me tell you why, and the why behind the push of aspirin is Bayer. Okay, Bayer makes it goes into their company, just Bayer, just all by themselves, $1.27 billion per year in aspirin sales. Wow. Do you think that they have an agenda? Do you think that there's a reason why they want you to take aspirin? I mean, there's guys that are a whole lot smarter than me, but to me it makes a lot of sense that may be one of the reasons. I don't know, but I think that might be the cause. Bernice, send me a note, hon. I really appreciate it. Love to help you out in any way that I possibly can. Lynn, how can I help you? Thank you for holding.
Oh, good afternoon. I have a question about heart failure. A person in the 80s years has been recently diagnosed with heart failure. Previously, last year, I guess, the person had like 50% ejection fraction. But my question to you is, can this recently diagnosed heart failure be reversed at all, and have you been able to do that?
Lynn, it depends how bad the damage is. You got to take a look at the heart, for example. There's 3 neurological supplies to the heart. The heart has a pacemaker that is built into the muscle of the heart. It has nerves from the spine, the back of the spine, that go to the heart. It has nerves from the brain called the vagus nerve. One big nerve, it's the longest nerve in your body, and it goes down and innervates the heart. So all of these neurological impulses have to be orchestrated properly. They have to sing in harmony. for the heart to work the way it's supposed to. So there's a lot that can be done. Also, the heart has an energetic system that is separate from the nervous system, and that, like any other piece of the body, that's an acupuncture situation. It has specific nutrients. The heart, more so than any other organ, maybe with the exception of the brain, needs two things very, very desperately. It needs coenzyme Q10 at a very high level. See, when you take all these things we're talking about, one of the reasons that you go into heart failure is it depletes CoQ10 or coenzyme Q10 or ubiquinol from the mitochondria, these little engines that sit into the muscles of the heart. And so subsequently it goes into shutdown, it goes into failure, it goes into fibrillation, where you feel the heart flopping around in your chest. So you have to look at it multidimensionally. We have had patients who've been diagnosed with congestive heart failure and have gone under care. We've treated them neurologically, we've treated them energetically, we've treated them with nutrition, changed their dietary patterns, but dramatically increased the nutrient bases as well, and these people do very well. I have a patient who I'm treating who has a mitochondrial problem, or no, excuse me, has a mitral valve problem, and years ago she was told that she had to have the valve replaced. Well, it was her choice not to do that, and she said, can you help me? I said, we're going to treat your nervous system, and we're going to balance your energetics, your acupuncture system, and we're going to change your diet. Well, 15 years later, she hasn't had that valve replaced, and she continues to do very well. So the short answer is there's much that can be done, but it's individualistic. It's not my patient. I don't know. But yes, indeed, if it was my family, I promise you that they would be treated that way, and making sure that they had the ability to, regardless of what the age is. It doesn't make any difference what the age is, as long as they're...
Can I ask who in your practice would specialize in that particular thing?
All of my doctors work that way. You can start in the acupuncture department and talk to Dr. Stephanie Pina. You can go in to see one of my other doctors. If you send me a note, Lynn, I'll tell you, where to start, and which doctor to see initially and so forth. I don't take a lot of new patients, but I supervise and look at virtually every case that comes into the office. So, Lynn, give me a call or send me a note. Appreciate it. Love to help you in any way that we possibly can. 888-630-9625. That's 888-630-9625. If you'd like to reach us off the air, you simply do that by going to rosellecare.com and send us a note. Don't forget, when I'm done with the program today, I'm headed down to the Angelica Film Center at the Mosaic in Merrifield, Virginia. Real quick to get there. It's a beautiful day. Why am I going there? Because we're showing the PBS twice-nominated Emmy Award on our work that we do in our office called Ageless Health. It's a $10 donation to Caring for Others. It's a tax deduction. And then I get to shake your hands. I get to meet you. Come on down and say hello. It's going to be a great afternoon. I'm going to introduce the program, and then we're going to show the film. It's about an hour long. I'm going to stay to answer any and all of your questions, and let me know what I can do to help you. That's why we're here. That's why we do the program. We're coming up to a break, and we'll be right back after a couple of very important messages.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Attend Diabetic Neuropathy with Dr. Scott Lamp on Wednesday, April 29th at 7:30 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 38 years of practice and almost 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com.
Washington's Mall, WMAL, where Washington comes to talk.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live every Sunday, 12 noon, right on the dial that you're looking at right now. You know when I say right on the dial, it can be digital, it can be your cell phone, it can be your iPad, but we're here at that very specific place, 888-630-9625. That's how you reach us here, and if you want to talk to me when I'm not here, you just do it by sending me a note. That's the easiest and fastest way of getting me to respond to you. Go to rosellecare.com, ROSELLECARE.com, and send it to me. And my staff will triage it. They'll send it to me. I will get back to you. If you need to talk to one of my doctors and just ask questions and find out what's going on, you can do that by calling 703-698-7117, 703-698-7117, and tell them that you need to talk to somebody about whatever the subject is, and they'll get somebody to call you back, and you can ask the questions. And again, don't forget our in-house programs. This afternoon, as soon as I leave here, 2 o'clock, Angelica Film Center, be there. It's a $10 donation to Caring for Others, 501c3, immediate tax deduction. I mean, where else can you go to get tons of information? Your $10 becomes a write-off. Bring friends. It's going to be fun. I'm going to hang out. I'm going to answer all your questions. It's going to be a good time. Frank, how can I help you, sir? Thank you for calling.
Hi. My questions are related to neurological condition, MS.
Okay, great.
Multiple sclerosis. And 21 years ago, I started on a program that I learned about that was started by an MD out at University of Oregon, University of Health Sciences, named Roy L. Swank, who put people with MS on a very low saturated fat diet and showed I'm an engineer. I know how to read charts and statistics and scatter plots and stuff. So he showed rather than the typical trajectory of the disease is, 20 years you go from neurological state fully up and active to, I forget whether it's state 0 or state 7, but whatever it is you're dead, basically, in 20 years.
Frank, if there's a question, we're coming up to the end of the program. I'd love to answer.
I'm sorry. Yeah, my question is, does your practice have any approach to people with MS?
One of the people that's going to be on the Ageless Health program that we're going to be viewing today is a young girl. When she came in to see us, she was about 29 years old, had very advanced MS. She went from 5 lesions to 24 lesions inside 2 months. And you can imagine the normal traditional program that she was under. So what I'm going to say to you is this. There is no one condition by name, whether it's MS or Parkinson's or Alzheimer's and so forth. There's a lot of commonality relative to the symptoms, but the approach always is individual based on exposures and so forth. In many situations, you're seeing heavy metal toxicity. In many situations, you're seeing trauma, injury that begins to perpetuate a breakdown of the nervous system. In many situations, you're seeing exposures to different types of foods, particularly things like the sodas, the Cokes and the Pepsis and so forth. I won't single out one because the phosphoric acid, and if they're Diet Cokes, the aspartame, it breaks down the neurological covering, the myelin sheath around the nerve root itself. So you have to look at it multidimensionally. Dr. Swank, if I remember, he's not with us anymore. And he was one of the guys that really looked at it from a point of, there's something other than medication that can be done for these people. And I disagree with one of the things as far as low-fat diets, as far as low-fat situations of toxic fats, yes, but the patient needs omega-3, 6, and 9s at very, very high levels. And unfortunately, Frank, we're coming up to the end of the program. I really would love to get into it. As a matter of fact, I'm going to do that this afternoon based on this one case that we're going to present. So if you're free, come on by. You're only in Tacoma Park. Take a ride. I'll see you, shake my hand, and let's talk a little bit. We're here every Sunday. I got to leave you now, and I got to run down to the Mosaic. Hopefully I'll see a whole lot of you there. Bye. This is Dr. Tom Roselle.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.